We now move on to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Faster Mai.
Good afternoon. You're saying that there's no one in hospital with COVID. I've been hearing from this gentleman that he went in, this is a couple of weeks ago, with COVID, but for something else very serious. He was in hospital, had a test, I think it was positive. Then he had another test a little while ago and was negative. And then he's had another test, the final test, and he proved positive again. And this happened, and now he's been discharged today, straight away, almost after having the test, it appears. Is this just to keep that number at zero? I mean, is this what we should expect? Are you being completely open and honest about those sort of things? And should we be worried that if someone's tested positive, they should be discharged?
Well, first and foremost, before I bring in the Health Minister, it's not going to massage figures, Paul, because he'd already been declared as having a positive case early on. So if he came back, he wouldn't be declared again because he'd already been recorded in the figures, and it wouldn't impact any decisions that we make. So just want to clear that one up. But I'll let David, if David knows anything, because obviously we don't get to know individual cases, but David may know something I don't.
Yeah, I can't comment on individual cases, you know, Paul, but what I can say is what the purpose of these figures are, because that's what we've got to go back to. The purpose of declaring the number of COVID-positive patients in hospital is to show that the pressure the hospital is under at any one time. So if there's pressures on the COVID ward, if there's pressures in ICU, so people can, in a transparent way, see what the hospital is having to deal with. Because again, we have to go back to the measures last year and why all these restrictions were brought in. One of the crucial things was about protecting the capacity of our NHS. So if the person is discharged from hospital, while they may still be an active case, they are not affecting the delivery of services in the hospital. So that is what that hospital figure is. It's not saying that someone has been in hospital, is now elsewhere. It is physically the number of people in the hospital, and that currently is zero.
My next question is this dreaded word herding. We keep hearing now the UK is about to reach herd immunity. It's something that if we're on the same path in the sense of proportionally getting the same amount of vaccines, is that something, because you haven't mentioned that word at all, is that something now that is in your timetable going forward when we have our own herd immunity built up to such an effect that we can really start living with this?
Okay, I don't know whether, David, you want to tackle that, and then Dr. Hewitt would come in after,
Yeah, if I
please.
can come in, Chief Minister, and then I'll bring the Director of Public Health in. I worry about the phrase herd immunity, because herd immunity is a very specific phrase that actually means once you've built up a certain amount of protection, everyone else within a community can be protected. Even with the vaccine, it does not guarantee someone cannot contract COVID and pass it on to someone else. Like I say, the transmission is looking very good. There's a reduction in transmission from the vaccine, but it's not absolute. So I think the words and the phrase herd immunity, certainly in some of the media in the UK, is being used a bit out of context of what herd immunity is, because certainly I've not seen any evidence to show that herd immunity is occurring from COVID-19. But I'll bring in the Director of Public Health.
Thank you, Minister. Yes, I absolutely agree with the comments you've just made there. I think the source of this specific question links back to a modelling study that was published last week, and I think it was by a team from University College London, in which they were forecasting that herd immunity either had been or was about to be reached, certainly in England, UK, and were postulating the positive consequences of that. Their modelling and their forecasting has been quite severely critiqued by others with expertise in this field. And I think I'm right in saying that the group that published this model actually have form in respect of publishing very over-optimistic models around projections for COVID and its impact in the past. So I think this particular study is not one we would give any particular weight to, and the comments that the Minister has just made about the difficulty of defining exactly what is meant by herd immunity, given the uncertainties around the impact of the vaccine across all potential outcomes. You know, it's too soon to be talking of that, and we certainly don't know what level of coverage would need to be reached to effectively stop transmission, which is what we'd really be talking about with herd immunity.
So once everyone's had the vaccine that wants it, that should be it, shouldn't it, to some degree? I mean, it gets to the point where 80%, whatever the population has been done, we would therefore be living with it because of the vaccination?
Well, obviously, I think we've always said, Paul, once we've vaccinated our most vulnerable groups, that's the groups 1 to 9, then we can start to make changes to our policies. 99% of the population, of our vulnerable population, will then have been vaccinated. That's what we've been working to. That's why we've put so much hard work into delivering what I think has been an outstanding vaccination programme, and a credit to all the people. We're on track to deliver that, and by the end of May, I think everyone will have had the vaccinations from that group.